Imagine paying, thousands of dollars for a highly specialized medical procedure only to find out that your daily 5-mile run is actively destroying the results.
Yeah, that sounds like a cruel joke, doesn't it?
I mean, you do everything right, you stay incredibly healthy, and your reward is watching your really expensive investment just vanish months ahead of schedule.
Right. Well, we tend to think of medical procedures as being binary, kind of like fixing a car.
You swap out a part, you patch a tire, and the repair is predictable.
Exactly. But when you step into the world of aesthetic medicine, specifically procedures dealing with soft tissue, the human body's metabolism is basically the ultimate ticking clock.
Because you're introducing materials into an environment that is in a constant state of flux.
You are. It's a dynamic living system.
So welcome to today's deep dive. Today we are looking at an increasingly popular intimate wellness procedure, which is the labial puff.
Or in clinical terms, labia majora augmenting.
Right. And it's designed to restore volume to the outer vaginal lips, volume that naturally depletes due to aging, childbirth, significant weight fluctuations, or the hormonal crash of menopause.
Yeah, it's becoming very common.
But our mission today isn't just to tell you what the procedure is. We're zeroing in on one highly specific, crucial question that anyone considering this wants to know.
Which is exactly how long do the results actually last?
Exactly. And spoiler alert, the answer isn't a simple number printed on a calendar.
No, not at all. The longevity of a labial puff is this really fascinating look at how your internal biology interacts with and sometimes actively fights against different medical interventions.
Which is wild to think about.
It is. Broadly speaking, the timeline you can expect depends entirely on the fundamental method chosen. You're essentially looking at two distinct paths here.
Okay, let's unpack this, because that fundamental choice sets the clock ticking at completely different speeds, right? Let's look at the baseline clinical reality.
Okay, method one is dermal fillers.
Right. These are primarily hyaluronic acid or AJ-based injectables.
Yeah, this is the quick route.
You walk into a clinic, have the procedure done under local anesthetic in like 30 to 45 minutes, and walk out with almost zero downtime.
It's very fast. But the clinical data shows these generally last anywhere from 6 to 18 months.
So it is definitively temporary.
Very temporary. I mean, it provides an instant enhancement, but your body immediately begins the process of dismantling that material.
Which brings us to method two.
Right, autologous fat grafting. This involves harvesting your own fat, usually from your abdomen, flanks, or inner thighs, using microliposuction.
And then processing it and injecting it into the labia majora.
Exactly.
Yeah.
So this is a minor surgical procedure requiring significant downtime, but surgeons tout it as offering permanent results.
It kind of sounds like the difference between renting a high-end apartment and building a house.
Oh, that's a great way to put it.
Like if you go with fillers, you're renting. It's quick, it's flexible, but ultimately temporary. You will have to keep renewing the lease.
Right.
But if you choose the fat transfer, you're building a house. It requires a lot of upfront construction, a bigger initial investment of time, money, and physical recovery.
But the structure is yours forever.
Exactly.
What's fascinating here, though, is that neither of those timelines is absolute. The temporary nature of the filler and the permanence of the fat are both entirely at the mercy of your lifestyle, your metabolic rate, and your cellular health.
So you can't just look at a cosmetic brochure that promises, 18 months and take it as a guarantee.
Definitely not. Not without understanding how your specific biology is going to react to the intruder.
Okay, so since dermal fillers are the temporary rental option, we really have to figure out the eviction process.
Let's do it.
If we know the window is 6 to 18 months, what biological mechanism is actively clearing that material out?
Well, to understand the eviction, we have to look at the tenet. The majority of injectables used for this are hyaluronic acid fillers. Clinical protocols from top cosmetic gynecology centers highlight specific formulations designed for this highly sensitive area, like Deserial or Nuvia Rose.
And hyaluronic acid isn't some foreign synthetic plastic, right? It's a polysaccharide.
Right, basically a complex chain of sugar molecules that naturally occurs in our skin and connective tissue.
Think of it as nature's ultimate water magnet. When it's injected into the labia majora, it acts like a microscopic sponge.
Exactly, pulling in moisture, boosting elasticity, and restoring a plump, hydrated look.
And because your body recognizes HA as a naturally occurring friendly substance, your immune system doesn't attack it.
Which is fantastic for avoiding allergic reactions or chronic inflammation.
But there's a catch.
There is. Because the body knows exactly what it is, it also knows exactly how to break it down. we produce an enzyme called hyaluronidase.
And its entire job is to seek out hyaluronic acid.
Break those complex sugar chains apart and allow the lymphatic system to clear them away.
So your body is basically cleaning up the mess.
Exactly. Now, manufacturers are actually trying to outsmart that enzymatic breakdown.
Yeah, the data shows some of these brands add unique chemical shields to their fillers. Like, for instance, Cereal contains mannitol,
Right, which acts as an antioxidant shield.
absorbing the free radicals that would normally degrade the HA, effectively buying the filler more time in the tissue.
And then you have Nouvia Rose, which is enriched with amino acids like glycine and L-proline.
Which provide the raw materials for collagen formation.
Right, hoping to leave some structural support behind as the gel dissolves. But they're essentially just buying time against an inevitable process.
And we also see the use of calcium hydroxylapatite or cachet fillers like Redias.
Yes, those play by a slightly different biological rulebook. Instead of just sugar chains acting like a sponge, PIHA consists of tiny calcium microspheres suspended in a water-based gel.
So the gel gives you the immediate volume, but those calcium microspheres act like scaffolding.
Right. They physically irritate the surrounding tissue just enough to wake up your body's fibroblasts.
Those are the cells responsible for building new collagen, right?
Exactly. And the clinical consensus is that because of this structural support, KHA fillers can last up to 2 years.
Oh, wow. 2 years is a lot longer.
It is, but even with that newly built collagen scaffolding, the initial volume from the water-based gel is still going to be metabolized eventually.
Because the ultimate timekeeper for both of these fillers is your basal metabolic rate.
Yes. The speed at which your body processes and breaks down these materials is heavily influenced by how fast your internal engine runs.
So patients with faster metabolisms simply burn through the filler much quicker.
They do.
Which brings us back to that incredibly counterintuitive fact from the beginning.
The exercise dilemma.
Yes. If you are listening to this and you are an avid runner, a skin class enthusiast, or a CrossFit athlete, you really have to calculate how your active lifestyle is going to eat into your investment.
You really do. Intense, regular exercise significantly shortens the lifespan of the filler.
Wait, so being incredibly healthy and working out a lot actually punishes you by destroying the results faster?
It sounds unfair, but biologically, it's just simple cause and effect. When you exercise intensely, your heart rate spikes, your blood flow increases, and your core body temperature rises.
Right.
That systemic heat and increased circulation mean the hyaluronidase enzymes responsible for breaking down the filler are suddenly working in overdrive.
So the marathon runner will almost certainly need a touch-up months before the person who lives a sedentary lifestyle.
Absolutely.
But it's not just the hyper-healthy habits that accelerate the clock. The clinical data points to smoking as an absolute destroyer of filler longevity.
Oh, yeah. Smoking introduces massive amounts of oxidative stress into the bloodstream. Basically, it creates free radicals.
And these free radicals act like microscopic wrecking balls.
Exactly. They physically smash into the chemical bonds of the hyaluronic acid gel and tear it apart much faster than your natural enzymes ever could.
Wow. And you also have to factor in the mechanical stress placed on the area, right? Because the labia majora is a functional protective cushion for the vulva.
Yes, it is subjected to constant movement, friction from clothing, and pressure from sitting or cycling.
And areas of the body with high mobility naturally process fillers faster. It's the same reason lip fillers break down quicker than cheek fillers.
Right, the constant physical friction literally massages the filler into the surrounding tissue, increasing its surface area and making it easier for enzymes to dissolve it.
Which is why the immediate aftercare protocols are so intensely strict. You are trying to protect the filler before it anchors into the tissue planes.
Yes, for the first 24 to 48 hours, the clinics mandate no hot showers, no saunas, and absolutely no heavy exercise.
You just cannot introduce heat and blood flow before the gel has stabilized.
No, and they also emphasize a strict ban on sexual intercourse for at least a week.
Because the physical pressure can literally flatten the filler or push it out of place before it sets.
Right. The one significant advantage to the HA fillers, despite their temporary nature, is reversibility.
Oh, right.
If a patient is unhappy with the aesthetic result, or if a rare complication occurs like a nodule forming, a clinician can simply inject a concentrated dose of that hyaluronidase enzyme.
And it dissolves the HA filler almost instantly.
Yes, it's the ultimate safety net.
But you cannot dissolve fat.
No, you cannot.
So knowing that fillers are temporary, that your metabolism might chew through them, that exercise shortens their lifespan, and that you have to keep returning to the clinic to pay for top-ups.
Right.
Why wouldn't someone just automatically choose the fat transfer? I mean, using your own tissue for a permanent result seems like the logical choice.
On paper, autologous fat grafting is the gold standard. As we said, there is zero risk of an allergic reaction because it is your own tissue.
Right.
However, the reality of achieving that permanent result involves a complex, often frustrating physiological gauntlet. The surgical guides make it exceptionally clear.
A fat transfer is not a one-and-done miracle straight out of the gate.
No, it is not.
We have to talk about the reabsorption phase.
Yes, this is crucial. When a surgeon harvests fat from your abdomen and injects it into the labia majora, those fat cells have been completely severed from their blood supply.
They are dropped into a new environment and basically forced to fend for themselves.
Exactly. To survive, they have to establish new microscopic blood vessels, which is a process called neovascularization.
Capillaries literally have to grow into the transferred fat to keep it alive.
They do. And a staggering amount of that fat loses the race.
The numbers on this were wild. Clinical studies indicate that anywhere from 30 to 50% of the transferred fat simply does not survive the relocation.
And some surgeons warn it can be as high as 70%.
50%.
Yeah. The cells that fail to establish a blood supply undergo necrosis. They die, and the body's lymphatic system quietly sweeps them away within the first 3 to 6 months.
So you go through liposuction, you endure surgical recovery, and you could potentially lose more than half of the volume you just paid to add.
Yes, which is a massive caveat.
And this explains why surgeons intentionally overfill the area during the initial procedure.
Exactly.
It's like planting a garden. You plant extra seeds, knowing some won't take root. You plant 20 seeds if you want 10 tomatoes, knowing the birds will eat some and some simply won't germinate.
Right, you inject far more fat than is aesthetically desired, anticipating a massive die-off.
But the ones that successfully establish a blood supply are there to stay.
Yes, and if we connect this to the bigger picture, the fat that does survive brings a hidden longevity bonus that fillers could never replicate.
Oh, tell me about this.
When a surgeon processes and transfers fat, they aren't just moving adipocytes, or fat cells. They are moving the stromal vascular fraction.
The stromal vascular fraction. Okay, let's break that down because it sounds incredibly dense.
It does. Within your fat tissue lives a complex mixture of regenerative cells, primarily mesenchymal stem cells and growth factors.
So these stem cells are basically cellular foremen.
Exactly. When they arrive in the labial tissue, they release signaling molecules that instruct the local cells to go into repair mode.
They stimulate massive new collagen production, build new vascular networks, and actively repair damaged tissue.
So it means it's not just about inflating a deflated balloon, it's about healing the tissue from the inside out.
Which is incredible. We see clinical reports from London showing this is highly effective for patients dealing with severe scarring, like from an episiotomy during childbirth, or even tissue damage resulting from pelvic radiotherapy.
Right, whereas fillers just sit under the skin, taking up space until they die. The stromal vascular fraction permanently upgrades the skin texture, the elasticity, and the hydration of the labia majora.
So the qualitative improvement to the tissue is permanent, even if you lose some of the sheer volume during that initial 3 to 6 month die-off?
Yes, but the journey to get there requires a significant commitment. We're talking about 2 sites of surgical trauma here.
Right, the donor site where the liposuction occurred and the recipient site?
Exactly.
And the physical reality for the listener involves wearing compression garments on your abdomen or thighs for up to 6 weeks.
And furthermore, you cannot sit directly on the treated area for prolonged periods during the first 2 weeks.
Wait, so if you have a normal desk job, you are looking at significant lifestyle disruption.
Major disruption. You essentially have to lay on your back or your side to prevent the physical pressure of your body weight from crushing the newly transferred fat cells before they establish their blood supply.
Oh, wow. And the emotional timeline is just as volatile as the physical one?
It really is.
Yeah.
You might look in the mirror week 2 and panic because the area looks drastically overfilled and swollen.
And then at month 2, you might panic again, worrying it's shrinking too rapidly as the body clears away the dead fat.
Exactly. You really do not see the final stabilized biological result until that 3 to 6 month mark.
Okay, let's fast forward. We've made it past the initial phases. The filler has settled nicely, or the surviving fat has successfully established its blood supply. We have achieved the baseline result. But the canvas holding that result continues to age.
Right.
How do ongoing life events alter these timelines?
Well, we must remember that permanent does not mean frozen in time. The transferred fat that survives behaves exactly like normal body fat.
Meaning it is living, breathing tissue deeply connected to your metabolic and caloric intake.
Exactly. If you gain 15 pounds, the fat cells in the labia majora will expand and increase in volume, matching the fat cells in your thighs.
And if you lose 15 pounds, those labial fat cells will shrink and the area will deflate.
Your aesthetic result is permanently tethered to the stability of your body weight.
So you really have to maintain your weight. And beyond weight fluctuations, we have to look at the hormonal landscape.
Yes, the timelines for both fillers and fat transfer are heavily dictated by a woman's estrogen levels.
Because estrogen is the hormone responsible for maintaining skin elasticity, blood flow, and tissue hydration.
And the labia majora are highly responsive to it.
Which explains why menopause is a massive catalyst for this procedure. The sudden drop in estrogen causes the vulvovaginal tissues to thin, dry out, and atrophy.
Right. But even if you've successfully completed a fat transfer, that inevitable drop in estrogen will continue to degrade the collagen scaffolding encasing the fat.
So the filler or the fat might stay, but the skin envelope holding it is still aging.
Yes. This reality means maintaining the result requires an ongoing adaptive strategy.
Like for fillers, you are looking at maintenance touch-ups every 9 to 18 months.
And for fat transfer, if the initial reabsorption phase was too aggressive, you might need a secondary top-up procedure at the 6-month mark.
But here's where it gets really interesting.
Oh, yeah?
Modern clinics are no longer relying on just a syringe of filler or a fat transfer in isolation.
No, they aren't. We are seeing a massive shift toward combination therapies to actively force the body to prolong the lifespan of the results.
They're optimizing the environment.
The most prominent example is combining the labial puff with PRP, or platelet-rich plasma therapy.
Right, where a clinician draws a small amount of your blood, spins it in a centrifuge to isolate and concentrate the platelets, and injects that golden plasma back into the labial tissue.
Platelets are essentially microscopic fertilizer. They are packed with growth factors.
So if you bathe newly transplanted fat cells in PRP, you are giving them a massive biological advantage.
Huge advantage. The PRP stimulates new blood vessel formations so rapidly that it significantly improves the graft survival rate.
It prevents a large portion of that 30 to 50% die-off.
Exactly. And if you mix PRP with a hyaluronic acid filler, it helps the gel integrate smoother and slows down the enzymatic breakdown.
We also see the widespread integration of radiofrequency devices and CO2 lasers, such as Thermiva or Photona Smooth.
Right. These energy-based devices deliver controlled thermal micro-injuries deep into the dermal layers without breaking the surface of the skin.
It sounds aggressive, but that heat triggers a massive healing response.
The body rushes to produce dense, tight new collagen and elastin fibers. Think of it like shrink wrapping the envelope.
Right. If you use a thermal laser to tighten and thicken the outer canvas of the labia majora, the fat or the filler underneath is held firmly in place.
You are completely changing the structural integrity of the area. It prevents the volume from migrating or sagging.
Which addresses the multi-layered reality of aging. Volume loss is one mechanical failure.
And skin laxity and textural degradation are another. You cannot fix thin, loose skin simply by pumping it full of volume. You have to treat the quality of the tissue itself.
Especially considering the constant micro-trauma the area endures, like chronic friction from cycling, horseback riding, or simply wearing tight yoga pants continually stresses the tissue.
It does. So the regenerative stem cells from the fat transfer, combined with PRP and laser shrink wrapping, create an environment that can actively repair that daily wear and tear.
You know, we should draw a clear line of distinction here, too, as the clinical guides often mention labiaplasty in the same breath.
Yes, that's an important point. They're frequently performed during the same surgical session, but they address entirely different anatomical structures and goals.
Because labiaplasty focuses on the labia minora, the inner lips. It's a reductive procedure, surgically removing excess tissue to reduce their size.
Whereas the labial puff, as we've explored, is entirely focused on the labia majora, the outer lips. It is an additive procedure focused on restoring lost volume.
So a patient dealing with post-childbirth changes might have elongated inner lips and deflated outer lips, meaning a surgeon will reduce the minora and plump the majora simultaneously for a complete rejuvenation.
Exactly.
So what does this all mean for you? If you are navigating the complex world of intimate wellness and considering a labial puff, the timeline of your final result is a partnership.
It really is. It is a negotiation between the medical materials used and the unique, highly active environment of your own body.
It requires an honest assessment of your lifestyle, your metabolic realities, and your willingness to undergo maintenance.
If you choose dermal fillers, you are opting for an immediate, reversible 6 to 18-month lease on volume, and your metabolism dictates the terms of that lease.
If you are a marathon runner, a smoker, or possess a naturally fast metabolism, expect the hyaluronidase enzymes to evict that filler much sooner.
It is an excellent way to test drive a result without surgical commitment, but it demands continuous upkeep.
And if you choose autologous fat transfer, you are committing to a surgical journey with genuine downtime and physical restrictions.
You are investing in a permanent biological solution, provided you can weather the initial 3 to 6 month reabsorption phase where your body ruthlessly decides how much of that fat actually survives.
And you must accept that the surviving fat will permanently expand and shrink in tandem with your overall body weight.
It's all about aligning your physical patience, your lifestyle habits, and your aesthetic goals. It isn't magic, it's biology.
It's just biology.
But this raises an important question and a genuinely fascinating philosophical thought when you review the clinical data.
Oh, what's that?
Well, surgeons frequently use the word permanent when describing a successful fat transfer, but they readily admit that this transferred fat will continue to respond to future weight loss, the hormonal crash of menopause, and the unstoppable natural degradation of the surrounding skin.
So it's permanent, but it's not.
Exactly. That makes you wonder, if our bodies are in a constant state of biological flux, continually breaking down, burning up, and rebuilding tissue, can any aesthetic procedure truly be considered permanent? Or are we simply resetting a biological clock that never actually stops ticking?